As a young kid, I had fantasized about being a physician. I was always better at sciences. I think that's very common for physicians, to be drawn towards biology and science, and it was just a natural fit of my aptitudes and things that I'm good at. Late in my residency, I started to realize that I like taking care of sicker patients, doing more complicated surgeries, and found myself migrating towards vascular surgery. We take care of a lot of folks who have problems with circulation in the legs and the consequences thereof, which can be difficulty walking, wounds on the feet, gangrene, trouble healing. So we do a lot of limb salvage, prevention of amputations, minor or major. And then we also take care of patients with carotid disease to prevent or reduce the probability of stroke associated with that. Aortic aneurysms in the abdominal cavity mostly. And then we do a lot of dialysis access. So patients who are on chronic or new starting dialysis, we establish the way for the dialysis folks to get into the bloodstream and clean the blood. We spend a fair amount of time in clinic, and actually it's, over the years it's turned into kind of one of the fun parts of the job is actually just the problem solving part of, figuring out what's wrong and creating a plan that solves the problem as safely as possible. Sometimes the answer is already present, and so we really just have to clarify what treatment options there are. So someone may come with an established diagnosis, and sometimes the diagnosis is not yet clear, and so we have to uncover the stones and turn them over and sort it out, and then create a plan to resolve that problem. In many circumstances in vascular care, these patients tend to have systemic disease, so we manage their problems longitudinally over time to try and prevent, the complications and the downstream effects of their vascular disease. It's also one of the parts of vascular surgery that ends up being, I think, more rewarding than perhaps other surgical specialties. And I've gotten to know many patients for years and years, and gotten to know their families.